Well, good afternoon, everybody, and welcome. Thank you to the folks with Chances Family Resource Center for hosting us today, and thank you to everybody who's come out this afternoon. My name is Dr. Smith, and as we introduce and discuss the results of the Child Protection Act review, I'll begin by recognizing our speaker. We have Honorable Tina Mundy, Minister of Family and Human Services, Chair of the Child Protection Act Review Advisory Committee. I'd also like to recognize hard workers, yes. I'd also like to recognize Danny, one of the youth representatives of the advisory committee. Danny was especially dedicated to the consultation process throughout last winter and spring, and his participation in the meetings and with family members and other people who care about child protection was very meaningful to people. And he was a valuable member of the committee throughout the whole of our work. So it's good to have Danny here today. It was my pleasure to of 15 members of the advisory committee reviewing the Child Protection Act. We were part of a process that heard directly from over 350 youth in care, meetings with community partners and service providers, in written submissions, and through private sessions where those were requested. The consultations yielded a rich and varied set of experiences, observations, and ideas for moving forward. But they also clustered together, and you'll see in the report this committee's identification of a set of themes, some related to public policy, some related to service delivery. Overarching, though, was the clear message that child protection is a shared responsibility of families and communities and government. A message that if we are to address root causes of parental harm and neglect of children, part of the work is comprehensive promotion of healthy child and family development, carried out collaboratively within and across government, communities, and this report acknowledges existing strengths in child protection and the reality that good work is being done. It also reflects messages about a sometimes reactionary approach and the reality of significance in the protection of children. The report includes 66 recommendations for action, some broad and some specific, some immediate and some long-term, in protecting our children. I'll now invite Patsy McLean to the podium, and Patsy will provide an overview of the consultation.
Thank you very much, Dr. Smith. I just want to apologize for a bit of a cold. I do have a bottle of me in the event that I need a little drink every few sentences. First off, I'd just like to say that it's been an absolute to chair the review of the Child Protection Act with such a broad and varied and committed advisory committee. We worked very hard together and very diligently, and I was so appreciative of the level of energy that the committee brought to this process. But most importantly, I was very privileged and proud to see the level of commitment that Islanders have to healthy children and their families, and that they. So we know that the primary purpose of the Child Protection Act is to protect children from parental harm due to abuse and neglect. And the legislation requires that every 5 years an advisory committee review the provisions of the Act, the services performed in accordance with the Act, and to report to the Minister concerning the operation and administration of the Act and whether its purposes and principles are being achieved. In November 2015, the advisory committee began its work on the Action Act review process. The committee was committed to making every effort to create opportunities for input and participation of Islanders, and in doing so, the committee invited groups to provide attendance at public consultations held in the winter and spring of 2016, attendance at partner and service provider consultations, admissions, attendance at private and confidential meetings. Service provider and partner consultations were held with various groups such as foster parents, justice personnel, medical and healthcare personnel, grandparents, the judiciary, and various community organizations, and children who are in the care of the Director of Child Protection. Child and Family Services staff were consulted, and Aboriginal communities were engaged. About 360 patient process. Child abuse and neglect are complex issues, and although child protection is everyone's responsibility, one professional service provider group taking a significant share of the responsibility for child protection work in PEI is child protection social workers. Every day, child protection social workers work diligently to ensure that children are safe from parental harm and neglect. Child protection social workers also play a significant role in the lives of children in care, acting as supports and as role models. By virtue of the Act, attracted comments on the perceptions of gaps, limitations, and failings of the child protection services, which represent systemic gaps, limitations, workers or child protection social workers as a group. Overall, the advisory committee heard significant appreciation of the difficult by child protection social workers. The current gaps in the child protection system were identified predominantly because of the way the system is currently configured. It is mandated to deliver. Throughout our process, the advisory committee heard important perspectives and recurring themes, and they relate to public policy, service delivery, root causes of parental neglect and harm of children. Islanders must view the protection of children and the promotion of healthy child and family development and well-being. This shared responsibility involves families, communities, and government. As we went about the island during our consultation process, many people asked us how are children at risk and their families. The advisory committee heard that the current Child Protection Act is narrowly focused in that children must child protection services to intervene. Many participants viewed this approach as a reactionary approach, which leads to gaps in services to high-risk children and youth who are not at risk of parental harm. The committee heard that a social policy framework on family development and well-being that is inclusive of Indigenous children and families and aimed at the collective responsibility of government, families, and communities is foundational to a framework that is developed must align with a provincial poverty reduction strategy and a population. There's a need for collaborative approaches to integrate programming that is delivered across government departments and in partnership with families and communities. Effective child protection services interventions need to be based upon structured decision-making processes and evidence, and there is a need for effective mechanisms to represent resources are required to address the need for a broader child welfare system in the province. The advisory committee heard that improvements in the delivery of child protection services are required, particularly an examination of the interpretation and application of the scope of the Child Protection Act is required, as it's currently viewed as narrow in its application. More effective resolution of child protection balance the interests of children and parental rights. Enhance partner and service provider collaboration, including mechanisms for timely sharing of extended services beyond the years of 18 years of age. Improvements are required in child protection services interventions, and awareness is needed for child protection issues. The Child Protection Act recognizes the unique cultural heritage of First Nations and Aboriginal individuals to ensure of PEI's First Nations and Aboriginal community. The Advisory Committee engaged the Aboriginal community in 3 engagement sessions. There were primary themes arising from these engagements, and they include fundamentally building trusting relationships with the Aboriginal communities. There was further discussion with the Aboriginal community effectiveness within child services and the approach to investigations in the Aboriginal communities. There's a need to close gaps in services for children and families living off reserve, and there is a need for enhanced program and for Aboriginal parents involved with child protection services. Based on the themes that were reoccurring as we went across the island, the advisory developed 66 recommendations under 2 broad categories: public policy recommendations and service delivery recommendations. The advisory committee's overarching recommendation is that government adopt a social policy framework in family development and well-being and the protection of children from parental harm. It is recommended that this is supported by the implementation of a 3-year action overseen by a senior leadership group comprised of deputy ministers, senior officials, and community members. A critical component of the framework is enhanced collaboration and supports programming delivered amongst and across departments. Other enabling public policy recommendations include support programming, positive parenting from 2 homes, the period of Purple Crying program, and other promotion and prevention such as the Best Start program. Establishing effective child protection services interventions grounded in evidence and structured decision-making processes are needed, and effective mechanisms for the effective data collection and measurement of outcomes for children in care is also required. Establishing mechanisms which children to enable children to authentically participate in matters that affect them is required, and reviewing current staffing resources to effectively support and high needs children and youth. To learn from the most unfortunate cases where children are seriously injured or die, the establishment in seriousness and a domestic homicide review is recommended. I would direct you to the comprehensive report of the review committee to look at the service delivery recommendations that are within the report. Highlights from the service delivery recommendations include the development of information sharing protocols, policies on collaborative case conferencing in high-risk cases, increased collaboration, as well as the extended services for children who are 16 to 18 years of age that will provide life skills programming and help transition them into independence. There will be a need for jurisdictional scans of the Child Protection, Director of Child Protection in Civil Custody Matters and the Victims of Family Violence Act proceedings, legal supports, including grandparents and others, as well as alternative dispute resolution and mediation approaches, which provide adversarial. We also recommend legislative amendments, and I would direct you to the report to review those as well. Respecting the Aboriginal engagement that was conducted in the jurisdiction of the government of Prince Edward Island and the Mi'kmaq First Nations governments, we did engage the Aboriginal communities, but it was not a formal consultation government to government. Therefore, we recommend senior provincial government representatives, First Nation and Aboriginal leaders be established to address the themes that arose from the Aboriginal engagement, and that these recommendations by the Truth and Reconciliation Commission of Canada in 2015. Due to the comprehensive and integrated nature of the recommendations, is a review of the 66 recommendations in their entirety to gain a full appreciation of the breadth, the depth, and the interconnectedness of the recommendations of the report. Partnership at the government and community level and a planned course of action for the implementation of these comprehensive recommendations is required. The committee has established realistic timelines for a number of the recommendations to ensure action is taken and momentum is achieved and sustained. The committee is optimistic that leadership and partnerships at the government and community challenge. History has shown us in our child protection systems in our mental health and addiction systems and our justice systems, and participants within have frequently reminded us that it is better to build strong children than it is to fix broken adults. Child protection is everyone's responsibility. I would ask to reweave the fabric.
Thank you very much, Pat. Now invite Minister Munday to speak and provide government's response to the report.
Thank you, Philip, and it is indeed my pleasure to be here today. I want to thank you all for coming to talk about how to better protect and support our island children. First of all, I'd like to recognize Patsy McLean and the members of the Advisory Committee for their tremendous work over the past in carrying out this important review. You spent hundreds of hours and heard hundreds of stories, many of them with hope. Provide your valuable input. Your stories helped shape and are mirrored in this report. To our frontline child workers, we recognize the importance every day. Every child needs a champion, someone who believes in them, believes that they can be all that they can be. Prince Edward Island champions. As Patsy highlighted, the report tells us that protecting children is everyone's responsibility, and the approach involving children and families and all parties is critical. Our child protection and justice systems do great work in protecting island children, but they cannot do it alone. The recommendations in this report provide government with an important information from which we can learn and advance in areas to protect vulnerable children. And we will act on recommendations beginning with 6 priority areas to improve accountability and further enhance frontline delivery service. Strengthen the voices of children. This will include hiring a children's lawyer to protect the rights of children during custody is already in progress on the rights of children. Third-party independent case reviews for quality improvement and improved policy and systems oversight. Take steps to support grandparents as primary caregivers. Government will give careful consideration approach and take action, including the introduction of a pilot project. Number 3, we will explore ways to improve data collection. Number 4, we will address legislative changes required to protect the best interests of the child. Government will review best and evidence related to the proposed amendments. Number 5, we will explore adopting a structured decision-making model, which will include child protection workers during investigations and when providing child protection services. Number 6, develop a social policy seen by principals to improve accountability, guide decision-making, and enable a focus on working together with parents, children, families, include the deputy ministers from Departments of Health, Family and Human Services, Health and Wellness, Justice and Public Safety, Education, Early Learning, and Executive Council. Government has also made many enhancements since the last review. Recent enhancements include implementation of which focuses on working collectively in situations to support families and those at high risk of harm. Investments have also been made in varying programs aimed at improving the lives of children. Purple Crying Program, Strongest Families, and The Visiting Place, which is a supervised access and exchange program. And we can always do better to ensure the voices of our children are heard. If we hope to address the root causes of parental harm and island, that protecting children and promoting healthy child and family development is everyone's responsibility. We must all do more to keep our children. Thank you.
Thank you very much, Minister Mundy. We're almost done with this formal part. Copies of the full available on the government website this afternoon, and there are some print copies here. Now, since you came out this afternoon, in whatever role brought you here, we know that you have an interest in this matter of protection of children. And so I would invite you to consider taking a decision right now to create the time this week to read through the full document, match up with your sense of things, or are there some surprises there? Do you find the recommendations compelling, or are there areas for improvement there? And perhaps, are there some of those recommendations that you think you'll take a special interest in, some actions that you might especially encourage or advocate for or do in the coming days and months? That can all be responsibility for child protection and for promoting healthy child and family development. That concludes the formal portion of what we're to stay to mingle and some refreshments and to have visits with interesting people who come into the room from time to time. Thank you. Hi guys, come on in.